Good day, everybody. My name is Dr. Taroub Harb Faramand. I'm the president of YHER, and we are delighted today to meet Mr. Mike Mukraine, who is a health system strengthening advisor on the Act to End Neglected Tropical Diseases Project. Welcome, Mike.
Thank you very much, Dr. Taroub. I'm happy to be on this forum.
Thank you so much, Mike. So, Mike, we would like to hear your thoughts about the relationship between neglected tropical diseases and gender-based violence. So if you can please elaborate on this and talk to us about your thoughts about Uganda in particular.
Yeah, thank you very much. Neglected tropical diseases and gender-based violence are things that move together in Uganda here. We know that neglected tropical diseases affect the poor people, the marginalized people in the villages. That's why they are called diseases of poverty. And we know that these diseases cause debilitating consequences, especially for diseases like schistosomiasis. We know that schistosomiasis brings about certain signs and symptoms that are not palatable to human beings. For example, and neglected tropical diseases affect both men and women. And they have different signs and symptoms in men and women. If we take a case of schistosomiasis, if it affects a woman, and you know that a woman, an African woman is supposed to deliver children, is supposed to be a fertile woman. When it affects her and she goes into the late stages, then cases of secondary infertility come in. And now, because the man is not comfortable, the man wants children, the man will put a lot of pressure on the woman, reaching an extent of even abandoning the woman in the home to go and look for another woman, which creates a lot of stigma and suffering for this woman who has been left because of a sickness that can be prevented or treated. But in Uganda here, the health workers are not well aware of female genital schistosomiasis. So there is a lot of misdiagnosis, there's a lot of underreporting, there is a lot of missed treatment. So when this happens, it even makes the issues for this woman very complicated, because they stay with that stigma. They feel that the community is looking at them as people who are sick. Something that I need to talk about, when you look at the signs and symptoms of female genital schistosomiasis, they involve things to do with vaginal bleeding, vaginal ulcers, which may imitate sexually transmitted infections. And you know that sexually transmitted infections are associated with promiscuity. So when a man learns of this, their mind runs into the woman has gone out of their family and gotten a disease from outside the family, which may even lead to physical violence within the home, because that creates a war between the man and the woman. Thank you.
Thank you so much, Mike, for your thoughts. How do you think we can reduce gender-based violence and prevent gender-based violence in Uganda in relation to neglected tropical diseases? And also, if you can quickly elaborate on what should we do at the systems level to reduce and prevent gender-based violence?
Yeah, at household level, if we want to reduce gender-based violence, we need to bring these issues out and make people informed of the consequences of gender-based violence. In Uganda here, we adapted the male involvement aspect, which we say these are role model men. Now, if you go to the men, because the perpetrators, they are mostly the perpetrators of gender-based violence in Uganda here. So when we use that approach to make the men know the consequences of gender-based violence and to make the women know their rights and know that, yes, as a woman, I have a right. I am not a slave to a man. Then the gender-based violence will reduce a bit. The other second thing is that, yes, Uganda is good. We have policies, we have strategies, but these ones remain at the national level. Now, if we take these down to the policymakers, to the community leaders, so that they know that these documents that protect women and men who are faced with gender-based violence, then it will be a very good opportunity for us to win the war. Now, at health systems level, we need to integrate NTD services into the mainstream Ministry of Health healthcare delivery system, because we know that NTDs are conducted, NTDs treatment and prevention services are conducted during campaigns. Now, when you do it during campaigns and you move to the field and come out of the field, then the cases that surface after you've left will not have good services if the health system is not strengthened in terms of improving the skills of health workers, in terms of availing commodities in the health facilities, in terms of having data captured for planning purposes, and in terms of looking at the entire service delivery, that from all the levels of the health system, we should have a point where the health workers can be able to treat to a certain level and refer to the next level if they cannot be able to manage. That will help a lot to treat and prevent NTDs within the community. And in the end, it will help to reduce on gender-based violence in homes. Thank you.
Thank you. Thank you, Mike, for your thoughts. We would like to have another interview for you for an expanded discussion. And I just want to mention that ACT to End Neglected Tropical Diseases is a project funded by USAID and led by RTI, and YHER is a partner leading gender equity and social inclusion work. Thank you all.
You're welcome, Dr. Taroub. Thank you.